Hi, good morning. I am Dr. Kishor KK, consultant pediatric neurologist in KK Child Neurology and Rehab Center and Sagar Hospital, Banshankari, Bangalore. So today I'll be discussing few points about epilepsy. So epilepsy is defined as an abnormal electrical activity in the brain which manifests as seizures. Whenever a patient has more than two seizures 24 hours apart, we call it as epilepsy. So epilepsy can occur at any age group. It can occur in the day one of life, or it can occur at 8 years for the first time. So the causes and the reasons for seizures or epilepsy is quite different in different age groups. So we need to evaluate. So normally epilepsy can occur because of the following reasons. If there is any structural problem in the brain has not developed, or any problem in the structure of the brain, or it could be a metabolic cause where sodium, potassium, and then a lot of glucose, all these metabolites like lactate, ammonia, if there is any abnormality, it can cause seizures. And then we have the genetic epilepsies, which are familial, or it can be first time in any child. And then we have even immune mediated or autoimmune epilepsies. So there is a various causes of epilepsy. So whenever a child presents with epilepsy, we need to evaluate the cause. So first we do an MRI to see if there is any structural problem. Then we do an EEG, means it is called electroencephalogram, which we record, put small leads on the brain, and we record the electrical activity of the brain like we do an ECG. Then we do basic metabolic testing and other things to find out what is the cause of seizures. Once we identify the type of seizures, whether it is focal, generalized, what is the cause, then we choose an appropriate anti-epileptic drug and start on the treatment. So once a patient is diagnosed with epilepsy, it is very important the compliance. So he has to take the medicines regularly, daily, for at least a minimum period of 2 to 3 years, and it is very important, it should not be missed. So normally recurrence of seizure, the risk of getting seizure is whenever they miss a medication, or they have a lot of strain, they don't get adequate sleep. So it is very important to have a good sleep of 7 to 8 hours, eat food time to time, avoid driving and swimming, and it's another is very important is have a regular follow-up with your physician, because every 2-3 months we adjust the dose, check for any side effects, and see what else can be done. So it is very important, once a patient is diagnosed, we follow these rules, and once you take 2 to 3 years of treatment, we taper and stop, and most of them like 70 to 80% can be treated and cured with epilepsy. Thank you.